Good afternoon to everyone. The Ministry of Health, the Federation of St. Kitts and Nevis continues its COVID-19 vaccination program. It's approximately 1 year since we've rolled out our COVID-19 vaccination program, and to date, we have achieved the following coverage rates. 82.4% of the adults in our population having received the first dose, 77% of the adults in our population have received 2 doses or are fully vaccinated. 9% of the adults have come forward and received the booster shot. In terms of our children aged 12 to 17 years, 18.2% of children in this age group have received the first dose, and 16.4% are fully vaccinated. So we continue our COVID-19 vaccination program because the COVID-19 vaccine is the first line of defense really against this coronavirus or the COVID-19 pandemic. 55.6% of our total population is fully vaccinated, and this slide provides you an idea as to the data disaggregated by island. So 77% of the adults in the Federation are fully vaxxed. 80.6% of the adults in St. Kitts are fully vaccinated. 67.5% of the adults in Nevis are fully vaccinated. And you see the corresponding numbers for the teenagers. Please note, the new international or global target is to aim and cover 70% of the population with COVID-19 vaccines. And so all countries globally are trying to achieve this goal. We are well on our way in terms of our having almost 56% of the population already fully vaccinated. Just by way of information, the government of St. Kitts and Nevis over these past 2 days received the 3rd tranche of the Pfizer-BioNTech vaccines from the United States government. So over these past 2 days, we received a total of 18,000 doses of the Pfizer-BioNTech vaccines, and we are expecting another batch of the AstraZeneca Oxford vaccines through the CARICOM Secretariat tomorrow, Thursday, and we expect 3,000 doses of the AstraZeneca Oxford vaccines tomorrow. Now, this shows data over this past week. So over this past week, 20 persons were added to our COVID-19 tally. They are newly diagnosed, as compared to 42 in the preceding week. In terms of the number of persons or cases recovered, we have had 12 this past week as compared to 208 in the preceding week. And so, ladies and gentlemen, we are almost at the end or out of this 4th wave or 4th outbreak of COVID-19 infections. Our numbers, meaning the newly diagnosed cases, are trending downwards. The numbers are declining, and we continue to see our cases recovering. This current wave, during this current wave, December, that's 2 months, almost 2 months, we've added 2,686 newly diagnosed cases within this past 2 months. We've had, there seems to be an error. We are following or monitoring 68 active cases at this point in time, and during this past month, we have had 12 COVID-19 related deaths. Now let's just focus on we want to pause and extend our sympathy to those who have, the family of those who have died recently as a result of COVID-19. These 12 individuals, when you look at the data, 11 out of the 12 were unvaccinated, so 92% of the recent cases unvaccinated. Only one was fully vaccinated. And in terms of age range, 92% of these cases, or 11 out of the 12, were older adults. They were over 60, and they all had chronic underlying medical conditions. And so again, I keep saying this repeatedly, the older adults amongst us, those who are unvaccinated, and those who have underlying chronic medical conditions, they are vulnerable. And so these are the individuals we want to reach out to. They should be our priority in terms of trying to empower them with the information such that they can, come on board in terms of accepting the COVID-19 vaccine. In terms of our response to COVID-19 over this past 2 years, we've had a total of 40 persons dying as a result of COVID, 7 from Nevis, 33 St. Kitts. 2/3 of these individuals were male, so there seems to be a higher risk of dying from COVID just by gender alone, male. And this is in keeping with the global trend. In terms of these 40 individuals, majority of them were unvaccinated, or 88% of these individuals were unvaccinated. A majority, 78% of these individuals were older adults. And so I want to just pause and, just speak directly to the older adults in our population, those older adults who may be tuned in this afternoon, who may be listening. Once you are over 60 and you are unvaccinated, you are vulnerable. You are at risk of picking up COVID, and you are at risk of moderate to severe disease. You are at risk of being hospitalized as a result of COVID, especially if you have any of these underlying medical conditions: diabetes, hypertension, heart disease, kidney or renal disease, stroke, cerebrovascular accident. So if you've had a stroke in the past, that's significant. And if you have been diagnosed with cancer. So if you have any of these underlying conditions and you are not yet vaccinated, we really want you to reconsider your position, because it's individuals like yourself who are at risk of moderate to severe disease and even dying. And we want to prevent any further deaths in this regard. And so I just want to try and, convince you, if you are hesitant about the vaccine, what are the factors contributing to your hesitancy? Is it that you have concern about the safety of the vaccine? Or is it that you are not convinced about the benefit of the vaccine to you? At the end of the day, we want to be able to convince you and bring you, and you are coming on board in terms of accepting the vaccine. So, vaccine safety. Please note that in terms of the Pfizer-BioNTech vaccine, over 10 billion doses have already been administered, and very little adverse or significant side effects. In the Caribbean alone, you have over 24 million vaccine doses being administered. In terms of St. Kitts and Nevis alone, we have administered over 57,000 doses of the vaccines combined together. So in terms of safety, it's relatively safe if you have diabetes, and you're taking your medication, if you have hypertension, if you've had a stroke, these conditions are not contraindicated. They do not prohibit you from taking the vaccine. Innumerable persons with conditions like these have already come on board and taken the vaccine. This slide provides you the current COVID-19 situation on the ground. So to date, 5,508 cases have been reported by the Federation. 5,400 of these cases have already recovered. We are monitoring 68 active cases, and as I said before, we've only reported 40 COVID-19 related deaths. And then these are just a reminder about the COVID-19 preventive and protection measures. The vaccine provides you that layer of protection against COVID, even Omicron, which seems to be milder, but yet still the older adults are succumbing to it. So we want you to really rethink your position and accept the vaccine. The wearing of the face mask is very important. We want you to maintain adequate hand hygiene and safe distance between yourself and others when you are interacting in public spaces. And if you are ill, experiencing any of the COVID-like symptoms, we want you to remain at home and not interact with others. Thank you.